dealing with medicine in the 21st century is dealing with some very complex technical procedures. And of course, before you can deliver those technical procedures, are they simple or complex, I think it's a very important to have access to simulations where you can learn very quietly and you can repeat and repeat and repeat again your technical procedure. And for sure, when it will come the time to go for real treatments, you will be more effective and much less stressed by accessing the patients.
Especially in the medicine, you don't want to train with patients. So I believe that simulation is quite important. Also, you can improve your team by performing regular simulation. And medicine is becoming more and more technical. Yeah. Also, if you are talking about drugs, the way the drugs are acting in different diseases. Also for that, you have some simulation. Simulation can be also software simulation, for example. So simulation, of course, for field like surgery is quite important, but for interventional radiology also. So you will have to do, as a medical student today in 2016, you should have to do with some simulation in a so large part of different diseases that it is necessary to have that. And it's very good if humanitas do that.
I think it's key to be able to have experience, and the traditional pathway we're doing right now is that we were gaining experience by working as a trainee with a very experienced operator and try to learn. So I think having a simulation environment where you can get some experience before you reach the patient is essential, and I'm sure that that will be helpful both for patients as well as younger physicians that are going to be trained to treat these patients. And of course, if you have such a center in the university, you can maybe market it, so you can also have dedicated sessions for people outside the university that maybe want to train in a certain method, in a certain technology, that experts could use the lab to show how to best do a certain treatment. So yes, I think it's very useful to have that.
One of the things that a young physician must do in order to help the patient to the best of their ability is become proficient in the best tools possible. As we advance as a society technologically, we are fortunately, through our research, bringing many of these devices to patient care, which improves the patient's life, assuming that it's used correctly. The best way to improve our ability is to gain experience. But of course, we want to do that without hurting patients, only helping patients. And the best way to do that is with centers such as the one that you describe of a simulation. So it is very critical in terms of our getting the best technology and to have the best experience with that technology to help the most patients in the best way possible.
This is a very important question. The incredible, terrific development of technology in the entire medical field is taking lots of the advantages to the new generations. One of them, in my opinion, one of the most important is exactly the possibility to gain experience, to learn the medical activity using the simulation systems. Simulation systems which unfortunately did not exist when I started my career, my work. Simulation is mandatory, is very important in several medical environments. Not only, for example, for surgical activities, because usually when you talk about simulation, immediately the idea goes to surgical activities. But for example, all the interventional procedures nowadays, when are studied starting from the simulation systems, are much more quickly, rapidly understood and learned by. So all the simulation systems, in my opinion, have the main advantage to shorten the learning curve of the different medical procedures. But simply, if I can add one more concept, simply going back to the simple study of anatomy and pathology, even before performing procedures on patients, is extremely facilitated using simulation systems. The learning curve is much shorter.